Israel is conducting a second day of major raids in the occupied West Bank. Using drones, helicopters and ground forces, the Israeli military said it is targeting militants from Hamas and Islamic Jihad. Palestinian health officials report at least 9 people killed since yesterday. The move into Jenin comes after Donald Trump lifted sanctions against ultranationalist Israeli settlers who attacked Palestinian villages. Meanwhile, aid trucks are also continuing to make their way into Gaza as the Israel-Hamas ceasefire appears to be holding. The United Nations said nearly 2,500 trucks have distributed food and medical supplies since the deal went into effect on Sunday. A convoy of construction vehicles has also entered from Egypt to help with the mammoth task of rebuilding following Israel's devastating 15-month siege. So now, for more on the ground and the situation on the ground in Gaza, we've reached Dr. Louisa Baxter. She's the health lead for Save the Children. Dr. Baxter, thank you so much for joining us today.
Thank you for having me.
We are now a few days into a ceasefire. I'm wondering if you can describe for us the scene on the ground.
So we're seeing more people moving in the streets now. People are trying to get back to some semblance of normality. The markets have a few more supplies. We haven't had drugs or medication that we need at the moment in yet, but hopefully it will move. Seeing lots more children now on the streets, many scavenging, begging for food, clearly many separated and unaccompanied. We know there's about 20,000 children in Gaza that have been separated from their families. Today I saw a little boy with a school bag on his back because they want to go back to school. It's been 15 months of no school for the children in Gaza. Some children have never known anything but the siege. And there's this real sense now of amongst the rubble and amongst all the destruction, let us start a new life, let us start something new.
You know, you talk a lot there about the situation that children are facing, and of course that would extend to the general population too. And according to the World Health Organization, only half of Gaza's 36 hospitals remain at least partially operational. So how challenging does that make it to then meet the needs of this population that, as you say, has been separated from families, has faced displacement, and of course, given the scale of the destruction as well?
Yeah, so about, we're saying more than 46,000 people in Gaza have been killed. Thousands are beneath the rubble. 100,000 or more are injured, and less than half of all hospitals are partially functioning. The health system really has collapsed and has been kept together by very small pockets of hospitals and clinics here and there. At the Save the Children Health Clinic, for example, we're seeing around 400 people a day, predominantly mothers, women and their children, coming in with simple things, childhood infections, injuries, and no medication to supply with them at the moment. So nothing, not even vaccinations to keep people going. We're seeing mothers who are desperate for antenatal checkups for their children, for postnatal checkups. We're seeing a lot of children who are going to require physiotherapy. And one of the real things that we're seeing a lot of is mental health challenges amongst families and amongst the younger children. I think figures are showing at the moment that about 80% of the children in Gaza are suffering from anxiety, depression, some form of PTSD. And we're seeing that in our clinics. Children are depressed, withdrawn, unable to make eye contact. And it's really now about how organizations like Save the Children can put those lives back together. For women, there needs to be particularly supported sexual and reproductive healthcare services. So try and get things like family planning going, try and get well women's clinics back going. So there's needs at every level, from the individual to the family to the community, that hospitals and clinics are desperately trying to meet.
Now, I believe you mentioned there that hundreds of people are seeking treatment every day or being treated every day. When we are talking about a situation where certainly there is a shortage of resources as aid does come in, but it doesn't quite meet the need just yet. And also, a shortage of personnel, physicians who might be able to handle the need there. How overwhelming is it as a doctor to be faced with this situation and be unable to help as much as you'd like?
I'm not going to be overwhelmed. Save the Children are not going to be overwhelmed. We're here, we have a job to do, and we're clear about what that is. It's about advocating that the ceasefire remains, that we get humanitarian supplies in, and that agencies like our own can provide the support needed to families, to children, to the entire population. Aid workers are committed, the people of Gaza are committed, and we start one step at a time. We start with one child at a time until there's a way forward.
And we talk also about the ceasefire holding for now, but tell us about the challenges going forward, looking ahead.
Well, it's challenging to plan in this setting, and what Save the Children has done is done a lot of contingency planning about what do we do if we need to move our clinics, or if populations are moving again, or if there's a therapy in trouble here. We've been doing a lot of contingency planning over the last couple of weeks, couple of months to get us to this place. But now it really is about restarting our services. And we started to be able to do that. We started to be able to add on additional services that the population need, like our well baby clinics, which is a way of transitioning out of the more critical programming into something that can help restore not just bodies, but minds and lives as well.
Dr. Baxter, I want to thank you very much for your time and for the work that you're doing. Thank you for joining us today.